our host, Daniel Burnaby, daily to inspire and motivate people to obey God's word and serve others for the God given gift. Tonight we have a great guest. His name is Adam. Adam, as we get a chance to invite him to our show tonight, Adam is the founder of Sylk Health, the first platform that lets you see what surgery actually costs in accredited hospitals in China, side by side with US prices. No forms, no phone calls, just the the real numbers. He studied medicine and ended up on the patient side of the system and built Sylk Health after watching a friend in Maine get abused by the American insurance and healthcare system. Welcome to DB podcast tonight. Adam, how are you doing?
Well, not too bad. Thank you very much. I appreciate the invite to be here. Doing quite all right. A little bit sick, but good to go.
Okay. And then you, you just mentioned before that you're supporting people now, different countries, as you're a doctor. Tell us more about that experience that you're facing right now.
Uh, well, it's somewhat unrelated to Sylk Health, but no, I'm just here in Ibadan, Nigeria, doing some volunteer work in one of the hospitals here. And deciding to catch a chest infection as a result of my efforts, but still doing some good work all the same.
Okay, you understand that as you're helping, that's happened, as you know, as doctors, many things can happen. But I congratulate you for a courageous effort to still helping people in
Thank you very
Nigeria
much.
country. Congratulations. We'll go back to our questions that we have for you. What made you decide to build Sylk Health, and what's the personal story behind it?
Well, the personal story is I've always wanted to be a doctor. I've always wanted to help people since I was a young child. I think that's a story for many people, as a matter of fact. But in my case, I've wanted to help people medically since as long as I can remember. And the chief reason for that being that I was very sick as a child, had a lot of asthma, and was in and out of hospital quite regularly. But as I've grown up and come into the world and things like that, I've made plenty of friends, and quite a few of them, being in the US, have had issues regarding their ability to access healthcare. And so, combining my understanding of the world, combining my understanding of Chinese medical practice from the doctors and practitioners that I'd met, I understood it to be a good idea to combine the two. And the personal story that really brought me here is, as you mentioned, I've got a friend in Maine, in the US. She lost her job about 12 months ago and developed very severe rheumatoid arthritis about 18 months ago. And in the time between developing arthritis her uh, and losing her health insurance, even though she did her best, and her doctors certainly did their best to try and get the correct treatment for her affliction, she was virtually denied at each and every turn by her insurance providers. And it's virtually that story that encouraged me to start pursuing the idea of providing healthcare for people who either couldn't afford it or couldn't access it in their own countries, but doing it abroad. And while there are many different services that provide medical tourism abroad, I think Sylk Health is one of a kind, especially when it comes to displaying the prices upfront without obfuscating or hiding them at all.
All right. Thank you so much, Adam, for all the explanation. What motivated you to create that platform to have people to get access to surgery. We appreciate that. And then thank you so much. And then we have another question for you. 82 million Americans are making financial trade-off to afford health care. How did we get there? And why
Well,
is it getting better?
well, healthcare or an inability to access healthcare is a worldwide issue. It doesn't really matter where you are. It doesn't matter whether you're in, well, in Africa, in Nigeria, such as myself right now. It doesn't matter whether you're in the US, apparently. Accessing healthcare is a very significant issue for both first, second, and third world countries alike. And so, when it comes specifically to the US, the reality of it is that yes, while it is a very wealthy country, that doesn't necessarily mean that all of its people are able to access healthcare. Certainly not without putting other undue financial constraints upon themselves and upon them and upon their families. And a very good example of that is that medical debt or the threat of medical debt is one of the chief leading causes of suicide in the US, and as a matter of fact, in a lot of other countries as well, but in particular the US. And the simple reality is that, say somebody develops cancer, for instance, and the only way they are able to treat it is by paying, 200, 300, 400, 500, $600,000. And that's simply not money that many people have. And the only way to do that might be to liquidate family assets, to sell their house or something like that. And, I'm sure, I'm not sure if you're a father, but sometimes you have to ask yourself, well, do I want my children to have a roof over their heads? Or do I want to save my own life, but possibly still die and leave my children without a home? And that's a question that many people, not just in the US, but worldwide, have to ask themselves. What choice do they make?
Wonderful, Adam. As you mentioned that if I'm a father, yes, I'm a father. I have two children, and then struggling with health insurance, especially when your kids are sick, is crucial. We need that, and, health insurance is not supposed to be a big deal, something impossible or difficult to have. It should be easier for every human being to have insurance because since you are living, you are working, you give your service to such a company or public or private, they ask you to give your insurance, and that can help you to cover for your medical expenses. If you're sick, if you have to have insured surgery, that's not supposed to be a big deal. And this is the biggest mistake any country can do, to make health insurance a luxury. It's not good.
No, most certainly not. In my opinion, the simple answer to it that it all boils down to in the end is greed. Um, an example of it being once again in the US, 34% of medical costs, for instance, aren't actually medical costs; they're administration costs.
Mhm.
And then all the other costs related to hospital and pharmaceuticals and so on and so forth. The vast majority of it is not going to doctors or nurses or radiologists or accessory staff. It's going into private investors. It's going to shareholders and things like that. It's not actually going towards the people who actually make people better. And so, one way or another, it really does come down to greed in the end, and that's why people die. That's why people. That's why people end up committing suicide. That's why people end up losing their homes. That's why people end up in very dire straits simply because some people are too greedy to charge reasonable prices for healthcare.
You're right. You're right. And then it's about businesses. Everything that you see people is doing is about businesses. And then people are earning money of the consequences of those who are dying. For instance, when you see people selling substances, they know those kind of substances to make people sick, but do enjoy it. For example, I remember I was listening to many ads about cigarettes is affected your health, but they keep selling it. For example, now we're getting the issue called that vapor. They know after a few years when some people smoking that will affect the lungs, but they keep selling it. And then they prevent people to get access to Medicare or to health insurance. It's so expensive, or sometimes you have to get such connections. That's life. And then I'm glad that you come with solution. You created a platform that can help people get access to that. Thank you. And I have another question for you that's going to be helpful to our listeners tonight. If someone listening right now is on any is unsure or facing a massive medical bill, what should they do first?
Well, the the solution varies from location to location, but I'm most familiar with the US, so I'll talk about the US. And perhaps the first thing to do, the most immediate thing to do, um, is to contact a patient advocate. As much as I should want to advertise my own business here, a patient advocate is the first port of call. And what patient advocates do is that they have an understanding of pretty much anything and everything medically related, in particular when it comes to the treatments that a person could or should receive. So they can make recommendations to a doctor, or they can advocate on your behalf, which is part of the name. Or in cases where a bill is either very high, very expensive, or is expected to be very high or very expensive, or there's some kind of issue of one description or another, they're able to intervene and act on your behalf, or at least advocate on your behalf. And the reason that is so important is because, well, they have a very good knowledge of the system that they have to operate within. Whereas you, as a patient, probably the first thing you really know about hospitals is that it's going to be expensive. But patient advocates have the ability, the knowledge, and the resources to be able to navigate within that system and try and get bills and fees down as low as possible. So I would say that is most definitely the first thing, the first port of call that any patient should make.
Thank you so much for all your input, how people can get help with the medical bills. This is the main issue. We work to pay the bills, whether your mortgage, electricity, internet, health, we work for something. But the most important part we need to work for is for your health. Basically, I'm working in a area of medical field. I am receptionist with doctors. I work in doctor's office, taking appointment, for patients. And then you can realize some health centers to don't take some type of health insurance, Medicaid, for example. They don't take it. And they say Medicaid is basically reserved for the low income people. Imagine
Mm.
that person is a low income. It doesn't they don't have Medicare. They have his indenture. And then it's not supposed to be like that. If that person is still alive, there's a way he should get access to see a doctor. And not a private doctor. It could be doctor like hospital. People can get access to that. I believe your point of view, as you are the founder of that great that great company. You said Sky Health, and then there's been important. Another question I have for you: where people can get access to view all your benefits you offer to them?
Well, I'm sorry, I'll have to correct you there. It's Sylk Health,
Oh,
Silk with a Y,
oh, Sick Health.
SYLK.
Oh, thank you, Sick Health. Thank you so much. All right.
Um, the way in which people can use our website, well, first of all, you'll have to go to sylkhealth.com, and that is Silk with a Y. And then the easiest way to do it is to search for a procedure that you need. So I would assume that most people who are looking for lower prices on procedures know what procedure they need to have or has been recommended to them. So we have a search functionality on our website, or we have a catalog of about 2,000 different medical procedures, and those procedures are have data on American healthcare prices. They have data on UK wait times for the National Health Service, and then what we do is we compare those prices and those wait times against the uploaded information from the healthcare providers that we partner with in China. So we're partnered with about currently about 15 different places, and they all provide their own data, whether they offer procedures or not. And then if they do offer a procedure, generally speaking, they will give us a price range for a particular procedure. So let's say it is a knee replacement, for instance. They will give us a price range of, say, between ten to $17,000 or something like that. And then that price range is uploaded, and it's for anyone visiting our website. It's really as simple as selecting a procedure, seeing all the different healthcare providers that offer that procedure and their prices, selecting one or selecting multiple, and then booking a consultation with that healthcare provider in a matter of minutes. And frankly, it can be done in under a minute if you really know what you're doing.
All right. Thank you so much for all the information you have provided to our listeners, and then everybody that been listening or that will review the interview that we have with Adam tonight. You can get access to the website as it mentioned to you right now, and then you'll be in contact with them, and then you help you with your bill, everything related to healthcare, can say to insurance. And Adam, do you have a last word to say to our listeners before we end up the show tonight?
I think the most important thing that I can say, or at least impart to anyone who's facing medical issues, is not necessarily just to use my service or anything like that. But the most important thing that can be done is to understand and appreciate that as a patient, generally speaking, you do have options. You're not necessarily limited to where you are or what's immediately in front of you. There are other options internationally, which may very well be superior to the options or lack of options that you have right now. So the best thing you can do is educate yourself and find out what options are available to you.
Thank you so much, Dr. Adam. Everyone, go to seekhealth.com to get all the resources you need and contact the doctor. You will find a solution. If you're living in the US specifically, contact him. You'll be amazed to see how you're going to get the solutions about your insurance. Thank you, Dr. Adam, for being part of the Big Talk Show. Can say DB Podcast. We hope to see you another day. Thank you so much. May you feel
Thank you
better.
very much.
Bye
Thank you
bye.
very much for having me.
You too.